mentioned this, that sometimes you do need other people, like a specialist or something else. And so how do you guys deal with that? If your patients, you're not involved with their insurance and like you need a specialist, or they already have a specialist, like what do you do? Are you out of the loop?
I may answer this a little bit differently so that you guys can answer that real question there. But one of the things that I do when I see a patient new for the first time and I see their list of specialists is I say, why do you go to this doctor? Why do you go to that doctor? And when they keep answering things that a primary care doctor should be handling, I say, well, do you want to continue to go to that doctor? So just a concrete example. Why do you go to your heart doctor? Well, I have high blood pressure. Okay, well, what do you take for it? Well, I take lisinopril. Okay, so do you really still need to see the heart doctor because I can give you your lisinopril? So I'll answer that question that way, and then they can talk about referrals. But we actually eliminate a lot of referrals that patients have had in the past and ongoing specialist treatments when they're not even really needed. And I would think, I mean, I don't know if there's any specialists in the room, but I know there's specialists out there who just get sick and tired of treating stuff that's so benign that they really think primary care doctors should take care of. But anyway, I'll stop there.
So with the extra time that we have as a DPC physician, we can really do so much more than we did before. So I find myself referring a lot less. I've been using a service called Rubicon, which is an e-consult service that I've found really invaluable. I think last year they were here at the DPC Summit and they stood up and they used me as an example of somebody who put in lots and lots of consults because you don't have to pay per consult. But really, I can be a dermatologist and an endocrinologist and a rheumatologist to a degree just by using this consult service. So I've found that my line is when they need a procedure, they need surgery or a scope. When I have a patient I've diagnosed with lupus and they need to be on treatment now, then I'm going to get them to the rheumatologist. So I'm taking things so much further than I did before, and it's really fun to do that and be a real doctor.
I agree with both of those, and additionally, I think I have so much more time now to actually talk with specialists. So I have patients in my practice who have been followed by specialists for years, and sometimes it's the patient initiating, saying like, I don't like traveling all the way across town, or this is really getting expensive for me. And so I have called those specialists and talked with them, and they are thrilled to have a primary care doctor contacting them, and many times they just give me the information that I need, and I will take over following that condition, and then, I can always get them back if needed. But there really is the increased time with direct primary care really allows, I think, all of us to care for a bigger breadth and depth than we were able to in the fee-for-service model.
Yeah, and I'll answer this. When I have patients ask me this question, what do I do about the specialists? I say, if it's something I can manage, I'll take over. If it's something that we can consult through our online clinical consult service and I can get enough information, we'll take over and get the assistance from the online clinical consult. If it's something where you need to go see a specialist, you might need to go see a specialist. And then I'll actually talk with them and communicate and make sure that that's something that is actually going to happen and happen well, that they have questions that they're going to be answering, and that we get the information that we need. So a good example of this, I have a patient that was needing to see the MFM for a pregnancy-related complication. Contacted the MFM, made sure it was an appropriate referral. I actually went with the patient to her appointment, got all of my questions asked, and made sure that she was advocated well for. And then she doesn't need to go back and see the MFM because I'm going to take over all the care from there. So it streamlines a lot of that from the patient perspective, saves her a ton of money. So